All right, thanks. Well, thanks for this opportunity to talk about what the National Library of Medicine and the National Institutes of Health are doing to realize the promise of data science and open science. As you know, NIH is increasingly interested in tackling big questions like precision medicine questions in All of Us, which is going to enroll 1 million people. It'll cross all kinds of different disciplinary boundaries, and I think provide a lot of information for prevention science. Some of the opportunities of All of Us include new ways to measure risk, discovery of biomarkers for disease and for treatment responses, identifying individual differences in treatment, looking at correlations of activities, genetics, and environmental measures to look at health outcomes, and develop new disease classifications and relationships. Of course, in addition to the opportunities, there are lots of challenges. How are we going to coordinate this large-scale data collection from many different kinds of sites? How are we going to deliver data to the right places at the right times in the right ways? How are we going to protect and preserve the privacy of participants? How are we going to synthesize all of this information into meaningful uses in health? And how are we going to help diverse publics harness the power of their personal health data? The answer to many of these questions is by working at the intersection of data science and open science. So data science brings together math and statistics, computer science and coding, and subject matter expertise to better understand data. It's a scientific and methodologic approach to understanding data, the same way that molecular biology is a scientific and methodologic approach to understanding disease. Data science has lots of opportunities for biomedical science, not only increasing the pace of discovery, but really even the nature of discovery, and allow us to discover things that wouldn't otherwise be discoverable. Data-related standards, for example, are necessary for these large cohort studies like All of Us. Machine learning, as Atul has mentioned, can be used for lots of things, including image understanding and even diagnostic uses. And big data analytics can get lots of meaning out of large and diverse overlapping data sets. Freeman Dyson once pointed out that new tools are essential to innovation in science. And of course, Thomas Kuhn talked about how paradigm changes can actually initiate scientific revolutions. So we've talked about a tool, data science. Now let's talk about a new way of doing science, open science. It's a new paradigm, a different way of doing science where the products and processes of research are made widely available. I refer to these things as research objects, and that they're broadly usable as well. Best practices in open science abide by the FAIR principles, which mean the data and the other digital research objects are findable, accessible, interoperable, and reusable. And when you share digital research objects such as data, software, publications, workflows, and so forth, and you do it fairly under these FAIR principles, that really is the fuel of open science, which again promotes sharing of more digital research objects. So the benefits of this are obvious. Even if you look just within a study, sharing the data that underlies that study, even if it is very idiosyncratic and you couldn't really aggregate it with anything else, if you've got the data, you can get a deeper understanding of the meaning of that paper. You might reanalyze the data and come to a different conclusion or additional insights. When you're able to share data across studies, it allows for rigorous comparison and analysis across those studies. It allows you to aggregate the data, like I was talking about in All of Us, for example, and as Atul was talking about at UC Health. It allows for data mining and big data analysis, and it promotes collaboration. It also promotes efficiency. You can expose negative results to the community so that people don't have to repeat an experiment that didn't turn out the way you expected to. And you can increase accountability. Of course, in order to have a rigorous look at reproducibility, you need the underlying digital research objects, not just the data, but the software that was used to analyze it and so forth. So open paradigms where you're sharing these things fairly adds value in lots of different ways. So we've got data science, which is like a new tool. We've got open science, which is like a new paradigm, and when you combine these, when you pair them, they're very powerful. And NIH has paired data science and open science to tackle big questions in the past. Perhaps the most iconic is the Human Genome Project, but since then, as I think you're all aware, there have been many others. And NIH research is going to get even more data-centric and more open. And this is being driven by societal expectations, where taxpayers are paying for the research. We generate $30 billion worth of data every year by NIH, and they figure that should be open to the public. Technical capabilities, of course, are actually, breathtaking. Scientific opportunities are starting to be recognized when you share data in usable ways. And of course, there are policy directives from publishers, funders, and others. I want to just mention one policy directive here, and I call this Opening Science by Memo. John Holdren, who was the director of the Office of Science and Technology Policy in 2013, issued a memo telling big research funding agencies that you need to make your publications and data more available to the public. We put together a plan and posted that in 2015, and we are now at the NIH actively implementing that plan, and I'll get to that in just a little bit. The National Library of Medicine lives at the intersection of data science and open science. We're an institute of NIH and have been for over 50 years. So as an institute, we have a focus in research, and our research focus includes data science. We're also the world's largest biomedical library, and a modern one at that. So we create and host major digital resources, tools, and services, not only for the literature, but also for scientific data, for data standards, and much more. Every day we send 115 terabytes and more to millions of users and receive over 15 terabytes from thousands of users. And as a library, we facilitate open science and scholarship by making digital research objects fair and attributable and sustainable. So now that the table is set, what's on the menu? Well, there are actually two menus I want to tell you about. One is the NLM strategic plan, which is very heavy in data science and open science. And the other is the NIH strategic plan for data science. So in 2017, we launched our NLM vision, which sees us as becoming a platform for biomedical discovery and data-powered health. We had 3 goals. These are operationalized versions of those. The first is to innovate, build, and sustain an open digital ecosystem for health information, for science, and for scholarship. We're in the process now of implementing the plan. In this first goal, we have a lot going on, connecting and enhancing our resources. I won't go through all of these in detail, but I presume the slides will be available and you can take a deeper dive. We're also very interested in innovating, expanding, and enhancing our research programs, both intramural research and extramural, awarding funds to people like Atul Butte. We're also advancing open science in some important ways. We're looking at value assessment for open science that actually Margaret is on. We're supporting Roundtable through the national academies to look at how we can align incentives across the enterprise, and we're doing a number of other things to move forward that open science. And finally, we are looking at how we can sustain ourselves, how we can sustain our infrastructures for computation, for physical infrastructure, and more. And we've done a number of very in-depth assessments of NLM and our resources. The second goal is to optimize user experience with NLM's digital resources and optimize the use of these. And we've done a number of implementation activities around those as well. And the third goal is to assure a data-savvy biomedical workforce and a data-ready public. Because at the National Library of Medicine, we're not only involved with investigators giving grants and doing research, but we also have a very big public-facing constituency. Some of the things that we've done here are expanding activities that are aimed at training data scientists, quad data scientists. So these are real experts in data science. But we're also interested in making sure that all biomedical researchers have an understanding of data science and open science that will allow them to take advantage of these very powerful elements in the enterprise to make the most of their research dollars. And so the idea is if you've never heard of machine learning, but clearly machine learning would be able to help you get to an answer, you should be, we're trying to disseminate that kind of information. We're also very interested in making sure that program officers and scientific review officers across all of NIH have a basic understanding of these things. If you've got now and you've submitted a grant application and you've got a budget item there for $12,000 to clean the data, we want to make sure that the program officer understands that that's a very important activity in disseminating your research findings. And finally, we want to make sure that the public can make the best use of our increasingly sophisticated resources. And so we've increased partnerships and some other programs at NLM. Now let me turn to the NIH Strategic Plan for Data Science and what it is. There are 5 goals in that strategic plan around data infrastructure, the data resources ecosystem, tools used in data science, and workforce development, much the way our interest is. And finally, stewardship and sustainability of an open science, data science kind of paradigm. The people that are implementing this right now are doing it under the Scientific Data Council, which is a trans-NIH group. There are 30-plus implementation teams that are very actively involved. My office, which is not a big office, I think we're on 7 of those teams. NLM is closely involved both in technical, scientific, and policy efforts in this area. But we're also recruiting a new NIH Chief Data Science Strategist who will be running a new office for data science strategies at NIH, and this is the person who will provide leadership and coordination once she or he is on board. So a key objective of the plan at NIH is sharing data fairly that results from NIH research. We are looking for ways to make sure that all data sets underlying publications are available, and I'll show you a few of those ways in just a minute. We also want to make sure that wherever the data are deposited, that the repository meets certain criteria, that it's going to be around for a while, that they pay appropriate attention to privacy and confidentiality and so forth. So we've put together a group that I ran along with Da-Wei Lin from NIAID to identify some of these key characteristics, and we'll be launching a request for information for public input, I hope, in the near future. Turning now to some of the actual ways we encourage and are facilitating data sharing. The first thing is we encourage folks to use existing data repositories that are well known in the research communities and that are open, of course. But we have other options as well. So right now, when your paper goes into PubMed Central, it has to go into that for if you've got NIH funding. You can attach up to 2 gigabytes of your data with that paper, and we're working on ways to make sure the data are findable in that separately from the literature, from the paper itself. If you've got more than 2 gigabytes of data, NIH is now working with a number of generic open data platforms, and we're looking to allow a deposit of up to 20 gigabytes of data. And finally, if you have very large data sets, and for very high value data sets, in the petabyte, up to the petabytes, I guess, we have a new initiative called Strides Cloud Partners that I'll talk about right now. So STRIDE stands for something that allows us to use STRIDES as an acronym. And basically what it is we have agreements right now with Google Cloud and Amazon Web Services to, I guess, buy at volume and to allow for discounts is one way of thinking about this. We're using something called Other Transaction Authority, which lets us do very different things than you can do with a contract or a grant. The benefits to NIH-supported investigators include discounted rates on cloud services, access to engineering, consulting, and other professional services related to cloud use, and access to both standard and customized training programs. So I think this is really going to facilitate the use of cloud resources by our investigators. These are some large data sets that we're in the process of moving to the cloud right now. You can see them. All of this research program data will be there. The Framingham Heart studies there. Our own NCBA data resources are on the way, and so forth. And now let me wrap up on the NIH plan with what has been done so far in terms of implementing it. In terms of data infrastructure, much of that implementation has been around these cloud services. In terms of modernizing the data ecosystem, we've done a number of things, including identifying needs for large-scale data resources, identifying needs of users, and doing an NIH-wide authentication and authorization implementation. These things sound kind of, they make your eyes glaze over, but they really are very important if we're going to make the most of data science and open science. In terms of data management and analytics, as I mentioned, we're linking data sets to publications in PubMed Central. We're identifying key characteristics of repositories, and we're planning to issue soon, funding opportunity announcement to support NIH knowledge bases and databases. And I should also mention that NLM has active right now an FOA on curation at scale. In terms of workforce development, there are a number of things happening both intramurally and extramurally. And in terms of stewardship and sustainability, we're working on drafting policy changes that I think are going to be very significant and will greatly facilitate open science in the biomedical research community. So let me finish this part by saying there are still challenges to realizing the promise of data science and open science. One is incentives. As you know, primarily the academic enterprise has incentives for publishing and has incentives for not sharing data. And what we need to do is come up with incentives that are not just incentive at a publisher and not just an incentive at a funder, but really across the enterprise, where these various actors across the enterprise are talking to each other and making sure that their incentives align with each other and that they're not inadvertently at cross purposes. This probably needs to be done domain by domain. And as I mentioned, we've got a National Academy panel that we are working with that will be addressing some of this. Another important challenge is at-scale curation and provenance, tracking the ownership and so forth and changes in these digital research objects. So as we are increasingly interested in software and the data sets and the publications and the workflows and all of these different digital research objects, it's important to make them findable, for example, to attach to them metadata, descriptions of what they are. And it's really, as we're looking at many of these things multiplying, it's not going to be feasible to attach consistent metadata to all of these things. So we have to think about using things like deep learning and blockchain technology to connect these things and to allow these digital research objects to imply their metadata rather than our applying metadata to them. And finally, we have to think about sustainability. Not all data are created equal, and so we have to figure out ways to identify valuable data in which to invest, both in terms of its infrastructure, in terms of policy, all kinds of things like that. So from the talk, I hope you've got 3 takeaways. One is that data science and open science promise to accelerate innovation and progress in biomedical research. Another is that NLM and NIH have very serious plans to realize this promise. And finally, that we are implementing these plans in very serious ways across all of NIH. And with that, let me thank my collaborators. This is my data science group at the National Library of Medicine. And I guess I'm okay to take a couple of questions, if there are some. Good. Thanks. Yep, good idea.
Thank you. Could you speak more to the training opportunities for pre-doctoral students, and especially coming from a social science perspective and trying to incorporate open science practices and data science expertise?
Well, I'll tell you that there's a lot of interest. Liz, do you want to say a few words about that?
So many of you may have heard of the BD2K program, which had a very large predoctoral training program, and that is now being administered at the National Library of Medicine. And ever since I joined OBSSR, I've been working diligently, in part in consultation with staff at NLM, particularly Valerie Florence and others, to help create an analogous program in the data science space specifically for the behavioral and social sciences researchers who I think really need it, and we need to be at that table. And I have an RFA that's been out on the street since October. The applications were due Monday, so stay tuned.
And I should say we're also interested in getting data scientists who aren't associated with biomedical data to come to biomedical data. And so we have mechanisms for that kind of training as well. One more.
Hi, so Colin Walsh from Vanderbilt. Thank you for a great talk. And we actually we have a T15 supporting data science research at our program that's been really successful, sort of espousing some of the principles we heard. So my question's a little tougher. I'm always envious of my computational biology colleagues. So when they publish a paper, they can package up an environment with all the data they used and share it with the community for replication and quality control. For those of us working in clinical electronic health records on one level, and then in my particular research, mental health and behavioral health, where those records are really sensitive, I would love to hear your vision around intersecting data science and open science for those types of problems.
Yeah, those are big problems. And we have, as I mentioned, at NIH, when we develop policy, it's a very sensitive kind of thing. And what we do is we roll it out through requests for information and get public comment on these things. So all I will say is that we are in the process of writing some of these RFIs, and that's really the best way to get comment from you. And that really does shape what NIH does. So if you see an RFI of interest to you, don't think that it's not going to have an impact. We really go through these things and analyze the responses carefully.
So we have a moment for a very brief question.
Okay.
We have an unusual problem. It's prevention science implementing the PACS Good Behavior game is growing at lightning speed. Alone, probably this August, we will train at least 6,000 teachers. That's a lot of kids. And we've already trained about maybe 40,000 teachers already. Now that's all across the United States, mostly because of the SOARS and opiate grants money. And we already have 2 studies showing population level changes, all accidental, not intentional. And what occurs to me is we have no mechanism to give data so that people could actually then look at changes in geographical areas. We already know it happens, but this is a new kind of problem. Most prevention science has never gone to this level of scale and the opportunity. And I don't know if this would work for something, it wasn't planned as a study.
Right.
It's an opportunity.
Right. So that's very interesting. And I've been at NIH for almost 30 years. I would suggest that you go to a program officer that you work with at NIH, or maybe talk with Liz as an initial contact, and see what can be done about that. Because I know, having been at NIH for a long time and having heard about some unique opportunities like this, we figure out ways to take care of that, to support it in some way, if we really think it's that valuable. So.
And that's something we might talk about a little bit further in the roundtable as well.